Good afternoon. This is Superintendent Margaret Marauder of Haverhill Public Schools, and I'm going to be joined today by our school physician, Dr. John Maddox, to talk a little bit about COVID in our schools and our communities, and just share with you all about the data that we know, the information that we have about our schools specifically, and what we know about transmission within schools. Dr. Maddox, thank you for joining us.
Sure, happy to be here and happy to help explain as much as I can.
Excellent. Maybe you can start. I know last night you were at school committee and you shared some information with school committee about transmission within schools, about transmission within models, and maybe a little bit about the different age groups and how transmission works within those age groups.
Sure. Well, I think one of the foundational questions that we, from a health standpoint, think about with schools is we're in the middle of a pandemic and COVID is happening around us, regardless of what's happening with the schools. So a fundamental question is, by having in-person school, are we making the pandemic any worse? Are we making more COVID cases than there would be otherwise? And so we really want to be able to monitor that and be able to answer that question as accurately as possible in real time.
Yeah, thank you. I mean, I think that's the question, right? That's the most important question. We all want our kids to be in school, but we need it to be safe.
Right. So a couple trends we highlighted at school committee last night that are just kind of overarching themes that we've learned, other countries that have kept their schools open longer, and then what we are learning as schools are reopening this fall in the US. So three sort of highlight areas. One is elementary schools are a much lower risk for COVID transmission than secondary school, secondary being middle and high school. There's a couple of reasons for that. One is that elementary school children tend to stay in the same classroom for most of the day, so they're not moving around class to class. And then secondly, children under the age of 10 really are much less likely to transmit COVID. You've heard of news reports where children are testing positive for COVID more often around the country as we do more tests. But the kids under the age of 10 are less likely to spread their COVID to other people, other children, and to adults. So we do need to think carefully about all schools, but we can feel a little bit more reassurance that elementary schools have a safer risk profile. The second of the three principles we covered last night at school committee was how community transmission, what's happening in the community, does have an impact on the schools. So if you have a lot of COVID going on in your community, you're more likely to have staff and students possibly bring that COVID into the school with them. And so we had to be mindful of that. And we entered the school year, Haverhill did, with a very low level of reported community transmission. We now have a higher level of community transmission, so we're mindful of that. And we're really trying to understand whether this is a permanent problem that we're going to have to adjust for, or whether this is a temporary increase in cases that will come down to a more moderate level in the weeks ahead. So we're monitoring that carefully. And then the third thing we covered last night was, how to think about all this in the context of, should the schools stay open? Should the schools go to full remote and close again for a period of time? And what we highlighted was what a difference we're making so far because of the hybrid model, where we have children that are in school, only in schools 2 days a week. And when you do that, when you change the model from 5 days a week to 2 days a week, plus add in masks and distancing and all the things we're doing, we're dramatically reducing the risk of COVID compared to what school would usually be like. So when you think about, should schools be open or schools be closed, you have to really think about, we've already reduced COVID transmission risk dramatically because of the hybrid model we're in. So those are the kind of the 3 points we made as an overview last night.
Thank you. I appreciate your sort of clarifying this for us from a medical lens. I think it's really helpful. Um, I think one of the important things that I see is that although we have had a few incidences of people coming to school that have the virus, and I guess I should take this opportunity to say that we're getting some calls from families. There's been a report on Fox News about some of the data from Haverhill. And unfortunately, the Department of Education took 2 weeks worth of data from Haverhill and put it into 1 week, making us making our numbers much higher for COVID for the week than they are or should be, or than other communities are. So there's sort of a data reporting error there that we're working with the Department of Education to fix, but I know it's frightening to families. And I think it's important to let families know, as I was saying, that we haven't seen any spread within our schools. So if a child or a teacher, and we've had a couple across the district over the last month that have come to school and then in the next day or two tested positive, there have been no people surrounding them that have caught the virus from them.
Right, that's correct. Yeah, I think that I saw in the report that you're talking about that, as you said, we had 8 students reported, and it erroneously said that was in 1 week's time, but in Haverhill that was actually over 2 weeks' time. And then 2 staff members. And the report was that there were 8 students and 2 staff members. The reality is that only 3 students over that 2-week period of time were in the building at a time when they were considered to have a contagious risk. So 3 students and 2 staff members over a period of 2 weeks were in the school buildings during a time when they were considered potentially contagious. And thankfully, as we've monitored those situations, because of the way that it was all handled, none of those people spread their COVID to anybody else in the school building. And we certainly hope to be able to continue that kind of success.
Yeah, thank you. And I think it's important just for me to sort of reiterate that we followed up closely on each of those cases, and that anybody who may have been in contact with that person has been contacted. We've offered testing. All that testing has resulted negative. So there are sort of no people hanging out there that have been in close contact with the person with COVID within our schools that haven't been notified and had conversations with our nursing staff and been giving instructions. So I think that's important to know, because I think people are afraid of the unknown right now.
Yeah, it's a scary time, and I think that one of the things that I've been really pleased, and I've seen this from your office, from the top of the administration down to the school nurse and the building level, is people are telling the information and sharing the information as accurately and honestly as we have. Sometimes you find out new information the next day, and we have to incorporate that. But I really think that sometimes the best antidote to some of the fear is just to be as transparent, as honest as possible. And I can say from personal experience, I've seen that without fail throughout the Haverhill system during this time.
Thank you. I think one of the things that people get a little bit nervous about is the whole contact tracing, and how do you know how far back in time to go, and when is a person symptomatic or considered contagious, whether they're symptomatic or asymptomatic. Can you just explain that?
Sure. So I think maybe we'll just use some days of the week, and we can actually speak from experience without mentioning any particular names.
Right.
So let's just talk about the idea that, how contagious is somebody? They have COVID in their body. How much could they spread it to somebody else? So some of that depends, again, on their age. So a kid under the age of 10 is less contagious. The fact that we're wearing masks, the fact that we're distancing, I think that mitigates a lot of how you perceive somebody who does have COVID and how likely they are to transmit that to somebody in the building at the same time. We know that close contact is within within 6 feet for 15 minutes, 10 to 15 minutes. So passing somebody in the hallway, being in a room where that person was earlier in the day, but now was not, you're really moving to a point where the risk is, it's getting very close to zero, even though the person did have COVID at that moment in time. So when you think about how contagious a person is, for the most part, we believe medically that has to do in somewhat with how much virus they have in them. So a person that is having a lot of symptoms likely has more virus in their body and more virus that could spread to somebody else with each cough or other way of spreading the virus. Again, with masks and with distancing, we're mitigating even that. But let's just talk about the person that starts having symptoms due to COVID. And let's say that person starts having symptoms on a Tuesday. They felt fine on Monday, and on Tuesday, they started to feel sick. They were in the building perhaps on a Monday, felt fine, no reason for them not to be there. And then on Tuesday, they started not feeling well. And they got tested, and it was obvious that they had COVID. Well, we would look at a period 48 hours prior to when those symptoms started. And we would say that anybody that was within 6 feet for 10 to 15 minutes or greater within the prior 48 hours of that person, so on Monday or on Sunday, would really need to take precautions. We would take those individuals and have them go into quarantine. And so we would take action because the person that started having symptoms on Tuesday, we would walk it back 48 hours, which would include Monday if they were in the school building. So that's one scenario. And then I'll talk for a minute about how a different window might look. But that's how we would have it if either the person had symptoms or had a positive test on a Tuesday. That's when their day zero would be. And so we would walk it back to a Monday or a Sunday and take appropriate action. Does that make sense?
It does. And I just want to highlight the 6 feet um, rule that you mentioned, because I think that that's important. That actually fed into our decision to move to a hybrid model. There are some Department of Education, different places were allowing schools to open up with only 3 feet of physical distance between students and between their desks. Across Haverhill, we've gone for 6 feet or more, and in most cases, it's more than the 6 feet, or in all cases, it's more than the 6 feet. Just to assure that people aren't within that zone routinely, right? Because that physical distance is really important.
Absolutely. So another scenario that's come up, and I think it involves some of those 8 children that were reported on the DESE and the Fox News report. 5 of those students would have been categorized as being COVID positive, but they did not have a contagious window while they were in person school. So they were registered as hybrid students, but I'll explain how that might work. So if a person had school on Monday, and then as we know, we initially started only 1 day a week. So that person was in school Monday, but not in school Tuesday because of the hybrid schedule. On Thursday, they got tested. Sometimes they got tested because they had an exposure. There's different reasons that people get tested, but they were feeling fine on Monday, Tuesday, Wednesday. They got tested on Thursday and were found to be positive COVID. If you take the 48-hour rule and walk it back, you go from their day zero, which is Thursday, you walk it back to Wednesday and to Tuesday, and you say they were not in the school building. And so, like I said, 5 of the 8 students that were listed on the public report were not, that's essentially their series of dates. They had a positive test, but the timing of their positive test and or symptoms was not in the window that included their time in school. So this is a question that we all wrestle with. Is at some point you do draw parameters that we do base in science. So somebody asked me, well, is there a possibility that that person that tested positive on Thursday could have had one shred of COVID virus in their body on Monday? And the answer is nobody can say that there's a zero chance of that. But the reality is the amount of COVID that would be in that person's system, given that they felt fine on Tuesday and felt fine on Wednesday, maybe even felt fine on Thursday, maybe we're an asymptomatic case. The amount of virus in their system on Monday was extraordinarily low if it wasn't zero. And they were wearing a mask and they were distanced. So I feel like with everything we're talking about, that's a situation where we can handle that differently. We can communicate openly to let people know this is what's happened, but we don't have to manage a Thursday situation the same day we manage a Tuesday situation in the scenarios that we laid out. And that's what's happened. We've had cases of both, and I've seen how both have been handled. I think they've been handled appropriately, and that's how we'll continue to monitor. Those the protocols we'll continue to abide by, but we will always be open to what science tells us if we need to monitor to handle that differently.
Okay, thank you. So those protocols, they're protocols that we've adopted as Haverhill Public Schools, but they're based on science and they're based on CDC guidance, and they're based on the state protocols, correct?
That's right. That's right. And I think that one of the things that we do a lot of is quarantining. And we do a lot of times where we say to somebody, if there is a risk that you could have been exposed to and possibly picked up COVID, we're going to be pretty quick to quarantine those people for 14 days so that we make sure they don't develop any COVID symptoms, that we test them if necessary, because all of us are trying to have an abundance of caution. We know that if we are cavalier and we know that if we're not careful, we will have COVID spreading, which is bad for health, and it's certainly not helpful for public confidence of what we're trying to do with in-person education.
Absolutely. And I thank you for sort of sharing with us today. And I know you've been just constantly available to us as a school system, and been spending a lot of time researching COVID and its impact on schools. You've been very supportive of we have a joint coronavirus response team, which is a team of administrators, yourself, public health people, school committee members, parents, teachers, teachers union, and we meet together on Wednesday nights and look at the data that comes out from the state. We kind of disaggregate that data, and we think about how it impacts our schools and how we need to respond to it moving forward, because it's a constantly evolving situation, and what we thought was true a month ago maybe isn't true today, or has changed in some ways. So we need to stay on top of that, and you've sort of been the rock there. So I thank you for that.
Well, I appreciate it. It's really a great team. I think that our head nurse, Katie Boziolis, we're lucky to have her. And I've said this before, I going through COVID pandemic with schools is not for the faint of heart. And I think that if you didn't have confidence in leadership from your office, I don't think it would be, it's possible. So I think the fact Haverhill should be proud of what we're trying to do. And I know that you're committed to the same thing I am, which is to be honest and to be wide-eyed open about what we're trying to do, and make sure that we try to do in-person education as much as we can, but always keeping safety of staff and students and community at the forefront of our decisions.
Absolutely. Thank you. I mean, we can't promise families what school's going to look like next week or what it's going to look like next month. but we can promise them that we'll pay close attention to the data, and we'll keep them posted on what that data looks like. And as a team, we'll make the best decisions that we can for the safety of everyone.
Yeah, I think so. I wish we could just make the pandemic go away, but we can't. So there are going to be cases. There will likely be a case of somebody catching COVID in the schools. I wish that I could promise that wasn't going to happen, but it's really hard with a district this size in the middle of a pandemic to guarantee zero. We never can guarantee no flu transmission. We never can guarantee all that if you're going to have in-person education, but we'll monitor it safely, and we'll continue to be as upfront and forthright with people as we can as we move through these unprecedented times.
All right. Well, I thank you for your time today, and I'm sure we'll be doing this again soon so that we can share information with people.
Sure, anytime.